guest, Heritage Foundation senior writer Kelsey Bolar. Great to see you, Kelsey. Your reaction to this, Alexandria Ocasio-Cortez campaigning for Bernie Sanders in Iowa. She said that, yes, socialists can take the battleground states, can take the Midwest because of economic struggles, that people there need and want radical change. What do you think?
Liz, I wouldn't be so sure about that. She was actually in the hometown where my husband was born and raised. I've been there many, many times, and I have to tell you, much of it is Trump country. And for those who do lean left, the Democrats, they're far more pragmatic Democrats rather than these far left radical socialists. There's a lot of small businesses out there which would be absolutely crippled. They would be forced to shut down if they were forced to implement policies like the $15 minimum wage that these socialist candidates are proposing. So I wouldn't be so sure that socialists have any chance of taking over the Midwest.
And to your point, the big thing that both AOC and Sanders are missing, it shows that they are out of touch with a big, powerful part of their own Democrat base. They're Democrat socialists, we understand. It's labor unions. They want to take away everyone's health insurance, put everyone in government-run health care coverage, but battleground states enjoy lower rates of people without health insurance versus the national average because of labor unions. Labor unions fight for good health coverage. That's why a big part why unions exist. The battleground states have higher rates of private health insurance coverage versus the national average. That's why Kaiser Family Foundation, the Cook Political Report polls show nearly 2/3 of voters in the swing states, the battleground states, don't like single payer. They say it's a bad idea. Bernie Sanders and Alexandria Ocasio-Cortez are way out of touch here. They're way out in left field with this.
You're right, and I think many Americans would like to see improvements to the healthcare system. The problem is that AOC and Bernie Sanders are arguing to completely, radically change the healthcare system as we know it. They just want to throw money at it, spend other people's money, supposedly fixing it, forcing people into plans where they have absolutely no choice in their healthcare decisions, instead of looking at innovative ways to improve our healthcare system that we're hearing from conservatives. For example, price transparency, so that when you go to a doctor, you go to a hospital, you actually know what you are paying for and can practice some personal autonomy in the decision making.
That's what the president just did this year. He did transparency in the health system. To your point, he's pushed for that executive order, executive action on that. Bernie Sanders and Alexandria Ocasio-Cortez can't get their messaging straight. Alexandria Ocasio-Cortez complains about insurance costs going up under Obamacare. As Bernie Sanders, he spent months of dodging. You know this, Kelsey. He refuses to answer questions about the cost of his government takeover. It's in the trillions. Now he tells CBS he has no idea what his single-payer government plan would cost. Watch this.
Your agenda has promised free health care for everybody, free college tuition, and to pay off people's college loans. The price tag for that is estimated to be $60 trillion over 10 years, correct?
Well, look, we have political opponents.
You don't know. You don't know how much your plan costs?
You don't know. Nobody knows. This is impossible.
You're going to propose a plan to the American people and you're not going to tell them how much it costs?
You know, this is why people think Bernie Sanders, critics say he's, quote, outrageous. He's outrageous in not answering the questions and getting this far, not being held to account. Obama officials have said neither Bernie Sanders nor Elizabeth Warren, neither of them got 60 votes for anything in the Senate. So why should voters go for this?
Well, it says a lot when the mainstream media is finally calling out Bernie Sanders for the lack of transparency for how much some of his plans would cost. And any poll that you hear, and anytime you hear pundits talk about these single-payer plans having any sort of public support, that support drops very quickly when voters actually find out how much they would have to pay for those plans and what those plans would entail. I think a big question we have to ask taxpayers is how much more are you willing to pay out of your own paycheck for these types of socialist programs that these candidates are out there calling for?
And government corruption and government-run health care. Bernie Sanders wants to tax the poor. He wants to tax households of just $29,000. He's on the record saying that. Kelsey Bolar, thank you so much for helping us out with the facts there. Good to see you.